we are about to learn.
All right. So today we have Vladimir Sainte, and he has over a decade of experience as a licensed clinical social worker and has made significant contributions to the Kansas City community through his work as a former child therapist and children's book author. Mr. Sainte currently serves as the senior project manager at University Health Behavioral Health, leveraging his expertise to guide others. Mr. Sainte holds a Bachelor's of Art degree in sociology from the University of Missouri, Kansas City, where he also obtained a Master's of Social Work. Throughout his years in the field, Mr. Sainte has helped individuals and families through challenging times. He is constantly inspired by his two children and looks forward to one day seeing the heroes they are meant to be. Just a little background, he's going to be talking about the STAR rating scale, which is something that used to be cultural competency, now advisory committee put together. University Health was one of the pilots for this. And so what we've seen is they have continued. And then just a little other background is that Mr. Sainte was my first intern at DFL. So it was the first time I met him many years ago and we kept in touch. So Vladimir.
Hello everyone, good evening. I'm gonna walk through the STAR rating scale. So to start off, I'm going to explore the why. When I came back, I took a little break from University Health, but when I came back, this was already in motion. And I kind of picked it up as the train was rolling, if you will. So from what I understand, our why of adapting the SRS to our policies and procedures kind of sparked around the murder of George Floyd. We wanted to basically be attentional in terms of how do we linguistically and culturally look at all of our policies and procedures to basically continue to do the right things, but with a different framework, if you will. So we wanted to respond with meeting, and from there, from what I understand, we applied for the tax levy in order to get this. What I also understand, this was back in 2020 when we first had our initial assessment and report. So when I started in 2022, was obviously 2 years later. So during the steering committee, in the initiation phase, members were meeting bi-weekly. That's how it started. So every other week they were getting together. And what was significant about this is that they were looking at, for every essential area, they were picking at least 2 to 3 different subsections to review during those meetings. And what we noticed was that it wasn't enough turnaround to assess all of the things that we needed to within that window. So we basically, it took a month to really go over one essential area, which made things a little problematic. The meetings included representation from our Equity, Diversity, and Inclusion Department, Senior Leadership, Diversity Committee, and our Workforce Development. So we had a robust steering committee, which also helped because there were different people. On 12/19, the committee following purpose. The purpose of the SRS steering committee is to monitor the progress toward reaching goals of STAR ratings, remove organizational and systematic barriers when needed. Is also a temporary purpose. From what I understand, this was a task force. So when I took over in terms of the execution, is that kind of reformatted our process. I moved us from bi-weekly to monthly, and I broke all the essential areas up into different months and made it I should just keep going with my notes here. So we began meeting monthly and reformatted monitoring approach by assigning one essential area per month for review, creating a 5-month period. That helped out tremendously because it gave us enough time to be curious and explore what our practices and policies look like, but also, I'll just go in here. So each month, the steering committee would evaluate original scores, go over previously provided documents from the initial assessment, and assess score change depending on new information. This, I kept asking why they're on our steering committee in terms of this assessment was back in 2020, it's 2022. Have there been changes since then? And there have been. But we were not kind of going backwards to kind of assessing what those changes were. So we were actually doing better than what we were evaluating ourselves. And that came from us kind of pausing and again, moving from bi-weekly. So for example, an original assessment, Central Area 2, Section 2.4, we originally were viewed as pending. However, after additional evaluation and monitoring by the committee members, it was decided to change our score from pending to ongoing. And I'm gonna beam you all on part of our dashboard here.
Do you have the name of the Central Area too? Sorry, I don't remember.
Language access and structure.
Okay.
I do apologize right now for people who do not like Excel. I do. This is my nerd kingdom, so I bear with me. So this is on our SharePoint page. I created this for our steering committee to make it more interactive. So if I assign a task, then other committee members can go on here in real time and put data and information. This whole system just made things a little more receptive. So as you can see at the bottom, can you all see that? So I designed this specifically to make sure that, again, each month we were really focusing on that one essential area. And we would go through each section, reviewing old documents, new documents, and following up if there were any leftover tasks from previous meetings that basically did not get completed. So we made sure that after that end of that meeting, all of our ducks were in a row. I also, and you will see the evolution from Essential Area 1 to, I think it was, yeah, to Essential Area 2. So I then started to add our original scores and what we proposed in terms of we are seeing differences and we're doing good work. So let's move up the metric.
And you all are scoring yourselves.
Yes.
So you're being very critical of yourself.
Intentional.
Yeah.
Very intentional. Very intentional. Another thing to go back to.
Can we real quick,
Yeah.
you just tell them what each essential area covers?
Yes.
If we have some newer people who might not know exactly what
Sure.
SRS is, so they can see what each essential area is. Real quick.
Yeah. So Central Area 1, the organization is diverse, equitable, and inclusive. Do you want me to just read through each section?
Or the top readiness for cultural change, is that?
Essential 1.
Yes.
Just so that they kind of know that's what
This for
that is.
change.
You don't have to read all of them, just so they kind of know what the
Broad
whole area,
title.
broad.
Last 2, language and access. ADA compliance, which was a really hard one to go through. That's another cool thing about this. The investigative piece that came from looking at our policies and things that people were lacking was interesting. And I'll go into three CIF forms that we were able to add to our EMR system. We had paper versions of them, but to translate them, it was on someone's task, but it just never was accomplished. So Central Area 4, Cultural Competency Plan, 5, which is one of my favorites, policy, sustainability, and commitment.
Well, I think it's interesting to talk about, how difficult ADA is, because ADA has been around for a long, long, long time. And, you all are, receive federal dollars and all of that kind of stuff. So you kind of you have to be compliant with ADA.
So
So you kind of take it for granted
Yeah.
that things are getting done until you delve into it and realize, oh, wow, yeah, we might be slacking in this area, or we thought this was happening. It was somebody's job that is now not getting done. So it's just interesting things that you take for granted that you expect are getting done, but once you delve into it at this level that you are, the realization that it may not be up to standard. So I applaud you for sharing that with us.
Oh, my pleasure. I'm always about transparency. There was a specific policy pertaining to our ADA that was interesting. And we all thought it was covered by employees, but it's more specific for clients. So it's interesting because I thought we had something. If it wasn't for SRS, I would never have come across that.
Mhm.
I'm so interested in that because it's been several years. So that happened to be the one that I worked on with a guy that I don't know if you ever knew Tomas Hernandez, but he got a social work degree. He was working on it anyway. And I thought that was the hardest one. And I was a little bit concerned, but everybody said, it's gotta be hard. I mean, it's a hard thing. So it's interesting to hear you say just kind of what that caused in terms of the level of thinking. So it's interesting. It's been probably what, three years plus since we developed that. So this is fascinating for us that worked on it.
We got some
So last one.
Can you read that out loud, Taryn?
it took an administrator at our hospital to break a leg to realize how un-ADA compliant our hospital
Showed
was.
you.
Mm.
Goodness mercy.
Huh?
Goodness mercy.
ADA is an ever evolving, I mean, it's a moving target, because once you do what you think you're supposed to, like the low hanging fruit, when I was at Truman, there was still like having issues with parking spaces and stuff like that. But then like are you really accessible to blind people? Probably not. I'd guarantee you most people are a big no on that one. So I mean, it's ever evolving.
So like, I'm sorry, I keep going on this because I get into stuff. I started nerding out about it, but when I was looking at the policy, it delineates specifically for clients, but when you look at it for employees, there's this line of accommodations. So if I have something, I can call Health and receive accommodations, but it was just a vast difference to look at what is specific.
So interesting.
Mm.
So, yeah, again, I wouldn't have known unless we took a deep dive. This framework allowed us to do. Notable change. So we were really proud about this. The following documents, they were again already translated in Spanish, but we were able to get them digitalized on our EMR system on eSafe. So our consent for psychotherapy, consent for agreement of services, and notice of privacy practices. So those are translated in Spanish. We still have a long way to go because we're still working on Arabic and other forms of languages. But right now, that's a win for us.
It's good.
Moving forward, in discussions with our steering committee, we decided to, I believe the essential area 5 covers communication with employees pertaining to cultural competencies, and we decided to make it more accessible system for our staff by adding it to our internal employee announcement called our Noble News Flash. And I can nerding situation here. Let me show you. Right, that looks like.
While you're looking for that, I'm going to say something real quick, if that's okay. So for those of you who are new on the board, this SRS tool, it was actually designed as a tool for agencies to do a self-assessment on these essential areas. And when it first got rolled out, agencies, they may have done an initial assessment, but realizing, wow, we really need some consultation in these particular areas and someone to help facilitate this. We did offer that people could get a few hours of help and, technical assistance in that area and stuff. We haven't really had anyone take us up on that, yet, but University Health is utilizing that tool in its most authentic intent. And that is, they're taking it upon themselves to have a committee around it and use it as a framework by which to evaluate and continue to monitor these essential areas within their organization.
That's great.
So
Connected to value-based pay, I thought, no.
it's coming up.
Yeah.
Piece coming up. So yes.
Wanted to, so the VBP has a lot going on. It's got many, many moving parts. And so we kind of felt like we wanted to get better at that before we added more moving parts. But we've always said, this is next.
Yeah, I thought there was some kind of.
Yeah, we really want to do it, but it's a little messy right now, and we want to kind of straighten that out before we add more.
That makes sense.
So within our cultural competency voyage, and utilizing this framework, each essential area has a template we can feed courses. So it's a rabbit hole, but we basically pulled out added it to, so this is our intranet. And this section is called Obstacle Cultural Competency. So we pulled those valuable resources and articles and added them here for employees to have access to them. And again, that's them from this framework.
Wow,
That's another change for us.
That's very cool.
Alright, so
Second.
we go back to moving forward. The bottom paragraph is a recommendation I provided to our steering committee after reviewing essential area 5. And so and again, the chair for the diversity committee is a member of the steering committee. This is a process that requires continual monitorization in a sense. So constant evaluation, just not as frequent in a sense. We did the legwork. We created created a dashboard in a sense for other committees to kind of review the policies moving forward. So that it's there. So that was just a recommendation I provided, and I believe we will move forward with it. Because again, from what I understand, the steering committee was it was not meant to exist for a long period of time. It was just to build the system and pass it along. Oh, and another cool thing. So for our behavioral health strategic plan, for our care section, because we have teach, heal, care, for our care section and promoting health and wellness, we are embedding SRS into our strategic plan to make it official in terms of we are really, our readiness for change it's apparent. So this is still in the works. I'm gonna show you guys, you have front row access. So we're going to continue establishing ED&I responsiveness through implementation of the STAR rating system, which offers a strategic framework to strengthen behavioral health approach towards a readiness for change. So we really, again, want to use this not just for our diversity committee, but for our trauma informed committee, safety committee, because it encompasses so many things.